and welcome to our Going Virtual webcast. My name is Nick Severino. I'm the Vice President of Marketing at First Stop Health. The Going Virtual webcast is here to dive into the topic of virtual care with various guests each month. This month, we're so happy and pleased to bring on our guest, Alice Clark, Chief Human Resources Officer with Vi-Jon. Welcome, Alice.
Thank you.
So glad you could make it on with us today. So before we dig into the topic of virtual care, I'd like to know a little bit more about you and your company. So let's start with you. Can you tell me a little bit about yourself?
Yes, I'm Alice Clark. I'm the Chief Human Resource Officer for Vi-Jon. I've been with Vi-Jon for about 6 years. We are primarily a private label company. Prior to working for Vi-Jon, I worked for a large aluminum company. Then I worked for multiple years for a private label food company and also for heavy industry with coal mining. So I've got a diverse background with labor and then also with manufacturing.
Can you tell me a little bit more about what your company does?
Yes, we make personal care items and products for lots of different companies under their label. We also make hand sanitizer under our label, which is Germex. We make alcohol, we make cosmetics, we make lotions, we make just a variety of different products, mouthwash, things that you would use in your home.
People know the Germex brand, especially going through the pandemic and the years that have just passed. So thank you all for what you do to help all of us get through those days. So let's dig in now, if you don't mind, a little bit about Vi-Jon's actual experience with virtual care. Like, what were you doing before the pandemic? What were you providing to your employees, and what was that service and situation like?
Prior to the pandemic, we did have a virtual physician care through our health insurance. We're self-insured, but it was through United Healthcare. We had tried multiple times to get that pushed out and to get employees to embrace it, and we just never could get them to latch on to embrace the virtual care through that medium. And so once the pandemic hit, we were working 24/7. We were considered an essential company, especially since we were making hand sanitizer and a lot of cleaning products. So we needed to make sure that our employees and their families felt safe. And we turned to our broker and said, we need help because we feel that having the availability for our employees to talk to a medical provider is just essential for us to be able to continue to run so that they have someone they can reach out to. And so our broker actually brought us to your company, First Stop Health.
Okay, great. So you added First Stop Health, I believe, in like second quarter of 2020, right when things were pretty much at the height of the pandemic.
Correct. Yes, we did.
Okay. Can you tell me a little bit about that experience of working with us and how we were able to help your employees maybe in the first couple months or so?
Yes. So like I said, we reached out to our broker. They suggested you guys. We interviewed you and a couple of other companies. We selected your company just based on the information you brought forth to us and some testimonials from other companies that you had worked with. Because we were in a very rushed situation to make sure that we got this to our employees very quickly, you guys were able to set this up for us in just a record time, and we were able to turn around and show that benefit to our employees very quickly, and so that they could see it. Again, the setup was very easy. Our employees, as far as they're used to being able to get into your system, was very easy too.
To get you up and running so quickly, especially during that critical time of the pandemic, and getting your essential workers, who your employees are, on board and doing what they needed to do. That's great. Can you maybe talk a little bit, if you don't mind, about some of the ways we were able to communicate or educate your workers regarding our service?
So we reached out to you guys and said, okay, we want this service. We need to be up and running very quickly. We are trying to manage, our business. We don't have time to put together marketing. We don't have time to do any of that. Can you guys help us? And you did. You provided us with flyers. You provided us with different things that we could send home with the employees. We had cards. We had all sorts of different items that kept everything right in front of them. We actually put big posters up. At that point, if you guys remember, no one wanted to touch anything when you entered in a facility. So we had your banners up as you entered into the facility so that people could see that. So you provided great marketing services to us in print, and it was very, very successful for us.
So, what about yourself? Have you had any experiences using our service or any other type of virtual care service out there?
Yes. So yes, I've used your service and a couple of different things. I'll give you a couple of different examples. If you remember when the pandemic first hit, you couldn't get to a physician, and we had questions just like every other company about, tell me about the vaccinations, tell me about how long people need to actually quarantine. We were able to call your physicians and they would walk us through it. Just, and it was such a relief to have someone that we could talk to in the medical community to help us walk through it. Now, I've also used it on a personal level, and it's very easy to use. And, I didn't feel well one morning, called before I ever went to work, got a physician, spoke to him. He actually prescribed a prescription for me. I picked it up on the way to work also, and it was seamless. It was quick in and out, which is what I needed. I also, another time that I used, I've used it more than twice, but another time that I've used it, I hurt my shoulder and I couldn't figure out what was going on. And I was actually flying back from St. Louis to Nashville. And I was getting ready to board the plane, and they called back. It was like really quick, and they called back. The physician said, tell me what's going on. I talked to him. He goes, put your arm out in front of you. And I put my arm out in front of me. He goes, okay, now raise it straight above your head. And I couldn't do it. He goes, you're going to have to go see someone. So it's, that's the kind of service you get too. It's not just like, okay, you have an issue, let me give you a prescription. He took the time to have me actually do something and then say, this really needs to be seen live. And so I appreciate that. It's not a situation where they're trying to treat everything. They'll treat what needs to be treated and then tell you if you need to see someone else.
Wow, well, that's great, and I'm so glad we were able to help you in those virtual settings. And you're spot on. I mean, healthcare now has now, I'll call it, doors to as a path now for people to get the care they need instead of needing to get in their car, take time off work, get childcare, transport, whether it be in a car, in a bus, or whatever they need, train to get to their appointment, sitting that germy waiting room, then wait in the doctor's office. All that can be accomplished with what we call digital first or virtual first care, whether it be urgent care or even some of the primary care components that you just spoke about. Being able to just talk with someone is important, who then can refer you on to someone else. So yeah, we feel that's a big strong part about what we do, and hopefully you found the same.
Absolutely, absolutely. The other thing that we have found are the physicians that are, and we've talked to our employees, how is it going? How do you feel about this? The other thing that we're finding is that physicians are generally prescribing medicine that is either generic or low cost. So they're not getting hit with, they're not getting hit with an expensive pharmacy bill when they go to pick up their prescriptions, which for our population is critical. When we're very thankful with that the physicians are really looking to see what can be prescribed and what can be prescribed in a cost-contained way.
Rising costs are all around us. It's good to know that, yes, our doctors have the resources and tools to guide people to affordable medications when necessary. So regarding virtual care, how does Vi-Jon prioritize, or what role does it have really in your benefit strategy?
It's been played an important role within our benefit strategy. We have, within the last year, really marketed, really pushed our employees towards virtual health for those types of visits that warrant that, right? We want them to really think about that from a convenience standpoint and from a cost standpoint. Vi-Jon is 100% employee owned, so we're an ESOP company. Every penny we spend on healthcare impacts our bottom line, which impacts their ESOP share value. So we've educated the employees on, being a good employee in the sense of being a good employee owner. And they've embraced that. And you can probably see that from some of our utilization rates that we've used. The other thing that, as we started to do our strategy, if we can push more employees to be comfortable and use this, then our overall cost for office visits, emergency rooms, all those types of visits have gone down. By using this and some other strategies that we've put in place, and again, I'll go back to 2020 when this went in place. So for the last 3 years, we've not had an increase in our health insurance cost. we've been able to use this and some other things that we've done and be able to keep our medical rates flat, which is, great for our employees and great for all of us too, so that we've not had that increase. And First Stop Health has been a part of that, for us being able to have people to make sure that they can get the care that they need, but also being able to do it at a price that does not impact our overall health insurance cost.
Your overall benefit strategy, Vi-Jon, is definitely doing what needs to be done. Just knowing and talking with other benefits leaders at other organizations, you are probably an exception to the rule. So whatever you folks are doing, keep doing it. We can continue to keep partnering with you to keep those increases out of your way for the next coming years here, hopefully.
Thank you. We hope so too.
So I could end with some additional comments here, and maybe before we do that, I'd love to just get your general feeling about, if there's one thing that you love most about First Stop Health, what is it?
It's the convenience for our employees. That's what I love the absolute most, is the availability for our employees. If they have a sick child, if they have a sick family member, for them to get that care without, like you said, we have offices in St. Louis, a manufacturing facility. A lot of our employees use public transportation. It's very difficult to take a sick child on public transportation, and you can get the convenience of that right there at home. So it's just been great. We also have a very diverse population, where we have a lot of employees that are first generation American. And so, you guys have been great to work with some language issues and things like that. So it's just a great benefit for us to share with our employees. And again, that's what we like. We like the ease and convenience, and that our employees are embracing and liking it.
Thank you. That's amazing. So glad to hear these stories from you, and positive results. So Alice, thank you so much again for joining the Going Virtual webcast. That'll actually wrap this month's edition, and we hope everyone watches our next monthly webcast. Thanks again, and have a wonderful day.